Welcome to the Canadian Beef Cattle Podcast, presented by the Beef Cattle Research Council, the most popular content from beefresearch.ca, available on the go. Before we get into this week's episode, a quick message from the BCRC. The Beef Cattle Research Council hosts a webinar series each year covering topics of importance to Canadian beef producers. These webinars are available free of charge thanks to guest speakers who volunteer their time and expertise to support advancements in the Canadian beef industry, and through the Knowledge Dissemination and Technology Transfer Project funded by the Canadian Beef Cattle Checkoff and Canada's Beef Science Cluster. You can register for the latest webinar series or watch past webinar recordings by clicking the link in the show notes. This episode is titled Top Tips for a Smooth Calving Season and features Stacey Domalewski with the Beef Cattle Research Council.
The most important day of a calf's life is the first one. There are some key factors that play a role in whether or not a baby calf gets off to a good start, and research has demonstrated that the first 24 hours of life are critical in order for a calf to survive to weaning and beyond. Interventions, follow-up care is important. Dystocia, or calving complications, pose a health risk for both the newborn calf and the cow. While dystocia can be partially managed with careful breeding choices and culling practices, proper nutrition, and managing for a body condition score of 3 on a scale of 1 to 5 before calving, difficult deliveries can still occur. Every scenario is different. However, once a water bag appears, a calf should hit the ground within 1 hour for cows or up to 1.5 hours for a first calf heifer. If this doesn't happen, intervention may be needed, especially if no progress has occurred for 30 minutes. The cow stops pushing, or there are other signs of trouble. If there's a problem, a water bag may not always appear, so be observant of other behaviors that signal labor, such as tail swishing, restlessness, the appearance of membranes or discharge, or a kink in the cow's tail. Calves born with assistance are less likely to drink colostrum on their own. Assisted calves are more likely to have reduced vigor or be mismothered and need proper care and attention to increase their ability to survive. If a calf is born with assistance, do not hang the calf upside down. Rather, place the calf in the recovery position to keep the airway open and better enable it to start breathing. Examples of what the recovery position looks like can be found in the show notes. Both cows and calves may benefit from pain medication following a difficult delivery. Administering an NSAID like meloxicam can help to promote cow recovery, improve her appetite, and lead to better milk production. If a calf's pain is managed, they will be more comfortable and more likely to get up and stay active, start nursing, and stay warm. Assess a calf's vigor by testing for a suckle reflex, placing a finger or two in the calf's mouth and gently tickle the roof of its mouth. If a calf has a strong suckle reflex within 10 minutes of birth, they will have a better chance of nursing the cow on their own without assistance. A calf with a weak suckle reflex will need monitoring and likely colostrum supplementation. A dazed or weak calf can be resuscitated. To simulate a calf, rub the chest vigorously, poke a clean straw into its nostril, or even dribble a small amount of water in the calf's ear. Colostrum, the sooner the better. Colostrum is full of fats, vitamins, and protein antibodies called immunoglobulins. These antibodies are essential to help a calf develop immunity to disease specific to the farm it's based on. Calves should suckle a recommended minimum of 1 liter of colostrum in the first 4 to 6 hours of life. Producers should pay attention to whether or not they see the baby calf nurse its mother. Look to see if the cow teats have been suckled, feel the calf's belly to see if it's full, or look at its hooves to see if the soft, rubbery capsule has been worn off, an indication that it has been standing up. If it doesn't look like the calf has what it needs, or it appears weak or dull, the following are some supplementation considerations. The best source of supplemental colostrum is from within your own herd. The freshly calved cow can be milked, or colostrum can be collected from another cow on your farm and frozen for up to 1 year. Never microwave colostrum, which can cook the antibodies and render them useless. Instead, place the bag of frozen colostrum in a bowl of warm water so it can gradually increase in temperature. Powdered colostrum is an option if fresh or frozen colostrum is unavailable. Read the package to determine if the product is a replacement or a supplement. Supplements contain fewer grams of immunoglobulins per liter, so 2 packages may be required to meet the needs of the calf. Veterinarians recommend feeding calves anywhere from a minimum of 100 grams of immunoglobulins up to 200 grams of immunoglobulins. Avoid colostrum sourced from other farms to prevent bringing unwanted disease to your herd. When administering colostrum, bottle feeding is better than tube feeding. A bottle will support the calf's suckle reflex, which in turn will ensure that the optimal amount of antibodies are absorbed into the calf's gut. Tube feeding is better than nothing. However, it places the milk directly into the rumen, which doesn't allow for maximum absorption. Use separately marked tubes or bottles for feeding colostrum and treating sick calves. This will prevent newborn calves from being exposed to the disease. Clean and disinfect bottles and tubes after each use. Disease prevention, keeping calving areas clean. The most effective way to manage disease in young calves is to manage the disease balance. If calves aren't exposed to bacteria and viruses that cause common calfhood diseases such as scours, septicemia, pneumonia, or navel ill, their risk of infection is going to be minimal. Disease outbreaks are less common when cattle are spread out, so if possible, reduce confinement. For producers calving on pasture, provide ample space for the expectant cows, then move pairs to fresh ground. This is referred to as a sandhills calving system, and more information on it can be found in the show notes. When calving in a corral, the principle of providing a clean environment remains the same. Provide lots of fresh, clean straw for bedding. This can also help ensure that cows' udders are kept clean and dry. Clean pens regularly. Disease-causing bacteria can lurk in common areas such as creep feeders, wind shelters, or calf huts. Ensure permanent structures are kept clean and well bedded. Move portable feeders and shelters often. Isolate and treat sick calves to prevent them from infecting healthy calves. Talk to your veterinarian and make sure your cow herd is up to date with vaccinations. Planning for a successful calving season starts months before the first calf of the year is born. However, the tips outlined above can help producers navigate the calving season now. More ideas of how to improve your odds of having healthy calves can be found in the show notes. Providing effective support for difficult deliveries, ensuring calves receive adequate colostrum, and keeping calving areas clean will allow producers to optimize the health, well-being, and profitability of this year's calf crop.
Thank you for listening to this week's episode. You can find all relevant links and information at beefresearch.ca or in the show notes. The Beef Cattle Research Council is funded by the Canadian Beef Cattle Checkoff and strives for excellence in the production of Canadian beef, cattle, and forage through research, innovation, and extension. Tune in every Tuesday as the Canadian Beef Cattle Podcast delivers straightforward insights, expert information, and a wealth of practical knowledge for Canadian beef producers. Subscribe now.